I want to show you something. There are two beakers in front of me. I'm going to fill each one with the exact volume of oil a patient would normally inject with. In order to show you that I'm going to deliver the same dose of testosterone, one of them will be 100 milligrams and the other will be 25 milligrams. And I'm going to fill each one to about 500 mils. So I'm going to attempt to do this carefully. This is a 1,000 mil beaker at the moment. So pretend this 500 is actually 1 mil. I'm just exaggerating it for demonstration purposes. Below here, this is going to represent 25 milligrams. Okay, so I'm just going to put 25 milligrams in that beaker. Okay, and this one is the same amount of volume. This is going to have 100 milligrams. So 4 of these. 1, 2, 3, 4. Okay, so what have I just shown you? The 25 milligrams has the same volume of liquid as these 4 ampules sitting in the same amount of liquid. So these 2 empty beakers represent one with the 25 milligrams, another with 100 milligrams. But the volume, the liquid, is the same. It's identical. You would be injecting the same volume with either one. However, the medication quantity is greater in this beaker compared to that beaker. So beaker A, this beaker, represents what we have in Europe, testosterone propionate, 25 milligrams per milliliter. Now to get 100, we had to put 400 milligrams of testosterone. We had to put 4 of these 25 milligrams into here. In actuality, we didn't use testosterone propionate. I used whatever we had laying around. I could have used marbles for that matter. So essentially, I've got 4 ampules for 100, and I've got 1 ampule for 25. Now, why am I showing this? Traditionally, these 4 ampules sitting in this beaker represents traditionally what most testosterones and ampules come in, or even if it's in a vial, it's 200 milligrams per milliliter, 250 milligrams per milliliter, 100 milligrams per milliliter, depending on where you are. And then people do microdosing. They take a smaller point out, so they are getting less volume, but it's more highly concentrated. Where this beaker, it's got more volume, but less concentration. So bear with me. I'll show you where this is going to get interesting. So the online TRT community, our patients that we come across, some patients get a little bit nervous about the volume in which they inject. They might panic. They might say there's too much oil, too much volume, too much they misperceive as inflammation. They'll look at this beaker and take a smaller amount, think it's safer and cleaner, because when they actually take the volume, the amount that they're going to inject to get that 25, it's smaller. But there is a difference. And it's the chemistry that's around that difference that I want to point out here about why smaller volumes may actually be more irritating in some cases than a larger volume, especially when it comes around testosterone propionate. And I think you really need to know that not all testosterone propionate is the same. Testosterone propionate in Europe has a unique concentration that has no preservative, but we'll get into that in a minute. So where does this volume obsession come from? We hear it a lot from patients. Many of our patients might be doing brilliantly on a daily or every other day of testosterone propionate. Some prefer testosterone cypionate, where there's a higher concentration but a smaller volume. There's some patients, not everyone, but some patients can get a little bit nervous around injecting 1 mil. So I'm going to show you what 1 mil looks like and why it's really not that big of a deal. So just for sake, these are testosterone propionate. This is what they come in the UK. And each ampule has no preservative in them. Not one. Okay? So when we open these up, your dose is going to be depending on what the doctor prescribes. But normally, if you were to do a daily dosing of testosterone propionate, this is what I use, a daily dose. It could be anywhere from this entire syringe, okay, 1 ml syringe, to 0.8. So it could be 0.8. It could be less. You might even prescribe half of this. Normally, for a subcutaneous injection, you would inject probably no more than half. Maybe you can get away with 0.6. But for 1 mil of an oil, you probably would be a lot, especially if you put in your belly fat. So there are other ways to do an injection that gives you the benefit of a smaller needle size. But we'll get into the moment. Right now, we're talking about volume. So I'll just do a demo of how we get this volume so you can kind of compare. The needle I'm taking now, this is called a blunt filled needle. You're only filling the syringe with this. You're not injecting with this ever. The purple needle never gets injected with this. I've said in previous videos. I'm not going to inject this, so I'm not going to wipe the top, but you pop open and then you just insert this. The fill needle, why it's fat and blunt, is because it's 18 gauge. It's really fat, so the lower the number, the fatter it is, and it's got a filter in there to filter out any glass particles that may have occurred after opening the ampule. And it makes it easier to draw out. Some people will use much smaller needles, especially for multi-dose vials, and it might take them a long time to fill. But because these are ampules, you don't have to worry about damaging the rubber bung. And you just open this thing up, and it quickly fills up. And if you're not too bothered by getting a full mil, if your dose is 0.9, 0.8, you can just take it all the way to the top. I've showed in other videos where you can squeeze out every last drop of a 1 mil volume into a 1 mil syringe. Other people like to have a 2 mil or 3 mil syringe to get the whole lot out. But really, sometimes with this testosterone propionate, a good dose is around 0.9 to 0.8. So nearly 20 milligrams, 18 to 20 milligrams, you can inject daily and get a really good result because you're doing it daily. And I think for many guys, this daily might be a trick to help maintain optimal levels, and you can get used to it. And some guys actually say they prefer doing a daily injection because they just set it and forget it. Every day they wake up and the first thing they do is they prepare the needle, syringe, their injection. I've had some guys say, oh, can I prepare it in advance? No. These have no preservative in them. Why would you do that? These are completely safe and sterile in the actual ampule that they're in now. Why would you risk having them sit overnight to get contaminated and risk your health? That's the most ridiculous thing I've ever heard. So don't do that. Don't even think about it. And most of these ampules in Europe come with no preservative. Okay, at least from this particular brand, because the preservative could be irritating or potentially be one of the causes of post-injection pain. Now, I know everyone watching in America, you may have tried through your compounding pharmacy to get testosterone propionate because it's not readily available. But usually they're making these things in America at a much higher concentration, 100 milligrams per mil. Okay, the testosterone propionate is the most soluble when you have more liquid and less of the actual solute, the thing that you're trying to dissolve. That's one of the keys for it to being a comfortable injection. I never feel injection pain. I've been doing these daily. Never injection pain from doing this. And I even do them intramuscularly. So on a particular day, I have to decide, do I want to go with the 25 gauge needle, the 23 gauge needle, or the 27 gauge needle? And obviously, as the numbers go up, they get thinner. And also the 27 gauge needles are actually a half of an inch long compared to a 1 inch. Now, I don't mind, because some days I don't mind, and I rotate them actually. So I'll pick the 27 gauge to show you. Can this become an intramuscular injection? Yes, but you have to go into the side of your hip or on the side of the glute. So you don't want to have a lot of fat if you inject it with this needle. But it's actually quite an effective way for those a bit of a needle phobe, not to mention a volume phobe. But anyway, this is the volume. That's the volume that you'd be injecting. In fact, let me just try. So this is about a 0.9 mils. Like I said, there are techniques to get it to the full 1 mil. That's 0.9 mils. Reasonable. You do it daily. You bang it in, I guess you can say, and you're good to go, making sure you've got all obviously the bubbles out. If you want to go a bit deeper, sometimes a deeper injection creates a depot-like effect. It's holding, storing, it's releasing it back into the surrounding bloodstream. That's absolutely fine. And this is what I prefer, the 23 gauge needle. You can see it's not too bad. I mean, clearly it's obviously longer, a little bit fatter than the 27 gauge, half of an inch needle, but it's still doable because, I've said this before, once you get it through the skin surface, that's where often the nerve endings are, you're really not going to notice a difference. And in fact, sometimes, depending on where you inject, going deeper does create that depot effect and you do feel better. So anyway, we diverged from our original topic, which was the volume, but I think it's important to also look at the syringe and the needle size as well. But we'll get back into that. the size of the injections. Everyone's going towards smaller syringes, smaller doses, smaller oil volume, maybe even using the insulin needle. That's another one, the insulin needle. I'll show you what that looks like here. So this is an insulin type needle here. It's all in one, very small. And when you use a multi-dose vial like testosterone cypionate, you pull out maybe 0.1, very, very tiny amount. So obviously that's it. But that tiny amount is maybe psychologically reassuring, but it's quite concentrated. And then obviously there's pros and cons to this. But the point of making this video is to share with you that don't be afraid of a slightly larger volume, even if you're injecting every single day. I'm doing it. Many of our patients are doing it. In Europe, we're very lucky because we have manufactured, safe, preservative-free testosterone propionate. Okay. But the purpose of this video is to get some of you hopefully over the fear, to let you know there are others and reassure you that it is possible and that there are many others out there doing it in this way and finding it safe, convenient. You get 4 in a pack with this particular testosterone version, and that your volume is the key, partly the key to making these things very comfortable to inject. Unlike the historical thoughts about the compounded testosterone propionate that, it's going to be painful. I'm going to get this post-injection pain. Not with these, not with this particular brand that we have at BMH. So like I said, the smaller volume, does make it look and feel safer, but smaller doesn't automatically mean it's going to be better, because the real question isn't how much oil is going in. The real question is what's in that oil and what's in that solution and what your body tissues have to actually deal with once it's in there. Many of you watch the channel on a regular basis, I can see from those numbers, we actually don't get as many people subscribing. And, subscribing is what drives the YouTube algorithm to present the videos to you and other people like you who might need this information. So if I can ask you to do us a favor, if you wouldn't mind subscribing to the channel, if you're not already subscribed, that would make a world of difference and definitely help grow the channel further so we can get this information out to others. But speaking of the numbers, when it comes to TRT and the kind of the fear around volume, so in addition to those numbers of subscribers, let me give you some maths about the online, TRT community that they never actually talk about, in some of the Reddit forums, etc. And it's about the daily injections, how many people are doing them? Are they optimal? So there's different protocols, right? Protocol A is the online optimized daily cypionate protocol. You normally 12 to 15 milligrams of testosterone cypionate per day. The standard concentration usually comes in a vial of 200 milligrams per milliliter, and the injection volume is like 0.075 mils, so barely 0.1 mils, usually in this insulin syringe. Protocol B is what I'm describing today. 20 to 25 milligrams of testosterone propionate per day. This is European medication concentrations, 25 milligrams per milliliter. This one here in the beaker, an injection volume, as I've shown you, between 0.8 and 0.9 mils. Not that much. And that's my daily injection. It's about 10 times the volume of what you'd find in this. But the beauty of the testosterone propionate is it's quite short acting, which means it goes in, it goes out within a day to 2 days. Now, most of the people that we've seen prescriptions from other clinics, they tend to do and even within our own clinic, when they do Cypionate, they tend to do a smaller volume. But it might not be ideal. We do hear of patients, even with a smaller volume, with the cottonseed oil, experiencing some irritations, potentially reactions, allergic reactions, or just general discomfort, even from the cottonseed oil, which is where the olive oil and testosterone propionate makes a big difference. So anyway, going back to the chemistry, to dissolve 200 milligrams of testosterone into a single milliliter of oil, that formulation has to use aggressive co-solvents, which is it's not really soluble. I mean, the testosterone needs to have, these other testosterones, they have to have a preservative like benzoyl alcohol and benzobenzoate. Benzoyl alcohol acts as a preservative. Some of the other carrier oils, like I said, are cottonseed oil, sometimes grapeseed oil, unlike our testosterone propionate that uses olive oil and a little bit of ethyl oleate. So that the European testosterone propionate that I'm prescribed and I'm describing contains 25 milligrams per milliliter. So this bad boy here, 25 milligrams per milliliter in a low concentration. It's an olive oil. That's the carrier, and a bit of ethyl oleate to make it very thin so that you can pass it through a finer needle, but there's no preservative, no benzyl alcohol, and it's just a single ampule. So you get what's in here, so you don't want to stop it. That formulation doesn't need heavy co-solvents because the 25 milligrams dissolves easily in the olive oil. And the chemistry is simple. The irritant load per milliliter of this 1 mil is generally low, potentially lower than the smaller volume of your 0.075 of the Cypionate that's made in cottonseed oil and has co-solvents and preservatives in it. So if you're going to use something every day, I would imagine the 1 mil prop, which I use, it's a larger volume, but it doesn't have the irritants in it. And when you actually calculate the total solvent load per week, the picture's not what the forums or what you would think it would be, because you're getting no preservative in the test prop daily, and you are getting preservatives even if it's a small volume. So the tissue doesn't respond to volume, it responds to chemistry. This is the point I want everyone to take away. Your body doesn't only respond to how much oil went into it. It responds to what that oil is made of. Now, what solvents are dissolved in it or not dissolved in it, how viscous, how thick it is, as well as how well your tissues can clear it. And it also matters how vascular your injection site is. A small volume of harsh, solvent-heavy oil and preservatives can potentially be more inflammatory than a larger volume of gentle olive oil-based formulation. That's not a controversial claim. It's the basic pharmacology. It's the same reason compounding pharmacies have started in other countries to, like in the USA, to offer grapeseed oil preparations, which has a thinner carrier oil, fewer reactions. I think also some are talking about ethyl oleate. And anyway, if there's a particular oil that you're fond of or the excipient, let us know in the comments below, because I believe there's another particular excipient that some are trying to formulate, potentially testosterone cypionate, and make it a little bit thinner. Low concentration testosterone propionate may generally feel better than this 0.75 mils, this tinier version of your heavy co-solvented cypionate. Now, let me get this straight. We have both options at the clinic, and many of our patients do absolutely fine with the smaller volume of the cottonseed oil base. And I'm not knocking that at all. But what I'm saying is, if your doctor prescribes a larger volume of testosterone propionate, don't be afraid of the volume. In fact, there may be benefits because there are no preservatives. And even though the volume is a little bit higher, there really shouldn't be any issues, especially if you tend to have a sensitivity or an allergy to the cottonseed oil. Many people don't, and so cottonseed is absolutely fine for the majority of patients. But if there is an issue, or if you prefer the shorter to medium acting testosterone propionate for some of its benefits, why not consider the testosterone propionate and not being afraid of the larger volume, because that larger volume is what might provide some of its comfort without any of the solvents. And by the way, these co-solvents, they're benzyl benzoate, benzyl alcohol. They're not toxic. They're generally safe. However, in some people, they could be slightly irritating. So I just want to get that clear. I don't want to make anyone who's on the testosterone cypionate fearful. It's just, I think there's just a bit of a misnomer around the testosterone propionate, and I just wanted to clear the air. So again, if you're happy on your testosterone enanthate, your testosterone cypionate, you're using a smaller volume, we have patients like that here at BMH. There's no problem at all with those. But if you have testosterone, but if you need or get prescribed testosterone propionate, don't be afraid of the volume, because it really could be, groundbreaking. It could really change the way you think about testosterone treatment if you haven't tried it before. That's all I'm saying. So this is the point I want every viewer to take away. Your body doesn't only respond to how much oil went in, it responds to what that oil is made of. And obviously there are solvents that are dissolved in the higher concentrations to make it go into solution. And again, those solvents are fine, might be more viscous than you like, where the testosterone propionate's less viscous. A small volume of the other medications, the cottonseed oil cypionate in particular, may in some people be more inflammatory, like I said, where a larger volume of the olive oil base, the ethyl oleate base formulation, may be less irritating to that individual patient. And it's the same reason that other compounding pharmacies have started offering, grapeseed oil preparations, or thinner carrier oils. And if there's a particular carrier or oil that you've heard of, let us know in the comments below. So anyway, the concentration of propionate may generally feel better compared to, the 1 mil or the 0.8 mil compared to the 0.7 and 0.1 mil of cypionate or enanthate. Okay, the next thing I want to address, and we hear this a lot, is subcutaneous versus IM. And it's something that is really a personal preference, though I've tended to see some data that the subcutaneous may take a little bit longer to absorb. It's sold as being more gentle, more stable. It's considered in some patients to be easier to do the injection. I'm all for that. And some will argue that it gives you less peaks, less troughs. But there's a slight pharmacokinetic issue around this. And there's some data from the Zyosted studies, which were done by the FDA. It's a weekly approved, actually preservative-free testosterone enanthate product. And from the package leaflet, from the prescribing information, so it's not anecdotal. It shows like the curve, and we'll put the curve on the screen. And the curve over 12 weeks of subcutaneous dosing of Zyosted, I think it's dosed with 0.5 ml in solution, and there's different strengths. But the top of the curve is quite flat. I mean, it's quite a bit lower than what you would normally expect to see for a given similar milligram per milligram of a testosterone enanthate that's done intramuscularly. So that's the nature of subcutaneous. It kind of buffers or slows down the release, or it even can make the release a bit erratic to what you'd normally expect to see in an intramuscular injection. Is that a big deal? It might not be. But if you are having any issues with your subcutaneous injections, we have seen people swap to the intramuscular injections and had a much more noticeable experience, because subcutaneous tissue, like I said earlier, is poorly vascularized. There's not a lot of blood vessels in it. It's literally a lot of fat, and it's designed to be metabolically slow and not to disperse the oil-based depot medications efficiently. So when you have a depot in the subcutaneous regions, it kind of just sits there. When you inject it into that fat, it just doesn't go anywhere. Some of it might absorb. There might be some capillaries it absorbs into, but a meaningful amount just stays in that depot, in that fat deposit, a lot longer than your actual dosing interval. So it could build up and release at weird times. And that's the amount that actually reaches your bloodstream consistently is going to be a small amount compared to what you think you injected, which is why sometimes you see these numbers that are lower than you'd expect. And that's what we've seen in those Zyosted pharmacokinetic studies as well. And in patients that do subcutaneous injections, milligram for milligram, they tend to be lower than what you would expect from an intramuscular injection, which gives you a bit of a higher number. It creates intramuscular injection creates the opposite effect. It's highly perfused, meaning lots of blood flows through there, and that oil-based depot can reach the bloodstream more quickly and more meaningfully, so that when you run milligram for milligram dose, you're going to see a slightly higher physiological level than you would with a subcutaneous injection, milligram for milligram. But like I said earlier, subcutaneous has a place. And to be fair, some patients do fantastically well, even at BMH, who are on subcutaneous injections. So it's not a bad thing. It's just an individualized thing to be aware of. It may feel like it's easier to inject. You've got control. But I do have to say one thing about subcutaneous, and that is this. Everyone loves to try this. So the one thing I want to say about the subcutaneous injections is this. It just seems, I think, ever since the late John Chrysler, or it's been popularized online, or maybe because people who have diabetes are doing the injection, or maybe it's just the self-control to be able to just look down in your belly fat and do your subcutaneous injection. Now, even in the best of times, if you're injecting HCG, let's face it, some people are doing peptides. These are all water-based, usually proteins or peptides, that they're not fat-based, they're not oil-based. So when you put it into the subcutaneous area in the midsection, even when you do it carefully, sometimes they even your HCG or HGH or whatever type of water-based type of injection, peptide protein injection you're doing, you can still get, and even diabetics, you can still get some minor scarring, or you can get some bruising along there. So you have to be careful. At BMH, we do offer subcutaneous injections for patients who do prefer it, but we also think shallow intramuscular injections might be an option. So why don't we do a model of this? Is if we take the side, so you have your normal glute injection, or the upper outer part of the quad, upper outer bit of the upper outer bit of your glute. Now, if you turn the model and to the side, almost along the hip, and is another location that's thin enough, has a bit of muscle, that you can do the injection, and you can use a much smaller needle, like the 27 gauge, half of an inch. And you can put a bit more volume in there as well. And you're getting it in the muscle, so you get all the benefits of intramuscular and the benefits of subcutaneous by just putting in that right location, in that particular location. So just some food for thought, that it might be an alternative that you may not have heard of or heard about on some of the somewhere online or elsewhere, or even your doctor may not have explained it to you. Like I said, the shallow intramuscular injection is something that is rarely discussed. It uses a shorter needle. It lands in more superficial muscle fibers, and it feels a bit closer to subcutaneous injection in terms of not being as uncomfortable, or as having the same level of discomfort or comfort as a subcutaneous, but you get real muscle tissue absorption kinetics. So for a lot of men, it's the best of both worlds. So anyway, this isn't about telling you everyone should switch to deep glute IMs, or everyone should do shallow IM, or everyone, should not do sub-Q. It's just giving you another option and some other information that you may not have considered. So what is a practical protocol? Okay, let me be clear about what I'm describing, because I don't want anyone to mishear me. So this isn't about the bodybuilding, blasting massive, amounts. I think some people misinterpret what we're saying here, because they say, oh, this is a lot. You're doing a lot. No, this is just the volume, but it doesn't have the concentration that this one has, both same volumes. So that's what we're talking about. The olive oil, the 25 milligrams, is a small amount, preservative-free, in a single-use ampule. And your dose could be anywhere from 1/2 ml to 1 ml, depending on what your doctor prescribes. You can rotate the sites all around. You can do daily injections, but overall, you might only be getting between, 100 and under 200 milligrams a week. That's a very different conversation from what other people talk about doing a daily injection of a whopping high concentration testosterone. That's not TRT. This is TRT in an area called microdosing. So speaking of microdosing, microdosing can mean years ago, microdosing was done once or twice a week, to now it could be daily. And there's a variation. Microdosing could be 3 times a week. But I want to talk about something that I've experienced, and that's why I think sometimes daily can feel better. And to be fair, it's for years and years and years, I thought this daily thing, I didn't want to have to be tethered to doing an injection day after day after day. And again, I'm not completely advocating for it, but I do want to share this with everyone, because you change over the years and your lifestyle, and you find that certain things work, certain things didn't work. For me, there's a combination of reasons why I thought I'd just try it. It just seemed to make sense to have this daily rhythm. And I didn't mind doing every 3 days and even every other day, and still that could be quite a good option. But for some reason, I think once you get past the psychological fear of the volume, because that did cross my mind, even though I'm not a volume phobe. I call some people who don't like the volume a volume phobe. I don't mean any disrespect, but I do. There are some people that they just crack on. They do this volume. There's no worries. And other people, they panic if it's anything more than, 0.07, so 0.07 or less. But we're all different. But I think if you can get over that psychological fear of volume, you might be surprised that some of the tools we have in the UK and Europe are quite advanced and quite reasonable. And I don't think in America they have always the same kind of ability to make the preservative-free option, which I think is fantastic for what we have. Anyway, after you get over that fear of volume, the next big question becomes a little bit more interesting. So if you think about the way why I think testosterone propionate can be a good alternative for some, is that it has a half-life about a day, so that means it's in your system for a couple of days. And that used to be considered a disadvantage. And you had to inject more often, which was considered, not normal. And in the era now of daily dosing, this is actually a feature, not a bug. So daily dosing of a shorter ester means a smoother blood level, fewer peaks and troughs, and more stable mood, and more stable libido, less of a hormonal roller coaster. But I want to pause here for a second, because there are peaks and troughs, and there are peaks and troughs in even the Cypionate that people are injecting daily. But the kinetics is that the Cypionate lingers a bit longer. So over time, it does build up. And it doesn't mean it won't build up either on the testosterone propionate. Because, if you're talking half-life of a day and a half, and you're doing it every day, you'll have a slight build-up. But the clearance is a little bit better. Some patients prefer it kicks in just a little bit quicker, but it's not massive, because even when we've accidentally measured, patients have gone in and got the blood test too soon. They did their injection, and then a day later, they were on Cypionate and they did the blood test. We still see a peak. You still see a peak. And if patients wait till the end of the trough, meaning before the next injection, if they're injecting, let's say, testosterone Cypionate, every 3 days, and we measure them at the third day, that's a trough. Or if you're doing every other day testosterone, you measure, right before the next injection, that's your trough. Or if you're doing daily and you're measuring the next day, that's your trough too. So, but we see the ups and we see the downs on the trough. That's my point, whether it's on the propionate, whether it's on the Cypionate. But I have seen over the years when people try to dose the Cypionate and even sustanon, which is not practical with the format, because there is a preservative. And it's definitely not practical for subcutaneous. It tends to cause the testosterone to linger a bit longer, and it builds on each other. So initially it looks fine, and then over time, a month later of doing this every single day, you will get a higher level at month 2 and 3 than you do in the first 3 or 4 weeks. So that's just how the kinetics work. So I personally like the testosterone propionate, because it's in, it's out, and you don't get quite as much of a buildup. But it's a personal preference. And again, at BMH, we offer all the different options for testosterone. I'm not knocking one over the other. It's just purely, I thought I would enlighten some, because many of you guys come to our clinic and you've got your mind made up and you want to try this one testosterone, which we're happy to have this, definitely the Cypionate's got lots of popularity. And I'm trying to shake it up a little bit and say, well, look, there may be some other options that we can tailor to your exact needs and potential experiences, and you may not have even considered. So when you come to BMH, you're coming to the experts in TRT to kind of help guide you. And, my years of experience, 30 years on TRT already, I hope that I've been through all of them as well. And maybe, I can help save you the trouble of having to try different things, because I've also tried them, and maybe these ideas may work for you in particular. But everyone's different. And again, this isn't medical advice, but it's something to consider when you do speak to our doctors about all the different options. And maybe there's an option you haven't thought about, potentially like testosterone propionate, but there could be others, and that we're happy to consider based on your individual needs. So I want to address something. Again, there's a particular fear that has come about in some of our patients. I do understand why some men or women can be nervous about this. And the 1 milliliter syringe does look a bit bigger. It feels a bit more serious. And if you spent years reading comments or talking to other people who just had your own biases telling you that larger volume means scar tissue, pain, or inflammation, of course, you may hesitate. But the fear is usually, not matching with reality in all cases. I think it depends on, if you are susceptible to the irritants, even if you use a smaller volume, for you, there may be particular irritants if there's a preparation that has preservatives, though if you're doing it less frequently, that's fine. You might have to do it daily. You might not have an issue like with the Cypionate, but there may be a consideration that a clean, preservative-free testosterone propionate, here available in the UK and Europe, is a good option for someone that is interested in doing microdosing, because it works better with their biochemistry. So even though you're doing the same exact milligrams, even though this volume is higher, you might have a more comfortable injection than you'd realize. So, the controversial take. So I'll say it plainly, parts of us in the online TRT community, let's just call it that, may have developed a volume phobia. Again, I've called you guys volume phobes. Not because of any weakness, and not because anyone's foolish. It just seems like a lot of volume. But because the conversation has drifted so far towards the volume in the syringe and not about the formulation, trying to just bring some light that the formulation makes a difference. I focused on the visuals, right? So you have got 1 ampule floating in here versus 4, same volume, but the concentration of this 1 ampule is obviously less concentrated than this. So remember these beakers. So anyway, speaking of daily injections, they might not be for everyone, and no one should change the protocol without proper clinical guidance from your doctor, whether it be at BMH or elsewhere, especially a doctor who understands the TRT pharmacology. You might even consider creams. But if you're already comfortable with your injection volume, or you're ready to get past the fear because that particular preparation isn't working for you, then maybe a slightly larger but gentler injection for you may be an answer that you may not have considered. So could a daily injection of testosterone propionate be the missing piece in your TRT protocol? Let us know in the comments. And to understand why daily dosing may improve stability, libido, mood, and overall response, why don't you watch our next video on this topic? If you like content like this, do click like and subscribe and hit the notification bell if you want to get our latest updates for when we drop content. It really does mean a lot. And until next time, to your wellness, this is Mike.